Let's see an NCLEX RN video on disasters, mass casualty incidents, and complex emergencies. Disaster public warning information should include boat information, instructions for evacuation, shelter-in-place instructions, disaster kit contents instructions, calming and reassuring messages, locations where to seek assistance and shelter. All but 3, all but 4, all but 5, all but 2. Disaster public warning information is an early warning system in real time ahead of the impact of the disaster. Its goal is to reduce deaths, injuries, and property damage caused by the disasters. When a disaster is happening, there is no time to assemble a disaster kit. So all but 3 is not needed. In the ICS or the Incident Command System, what is the appropriate span of control? 2 to 8, 4 to 9, 3 to 7, 5 to 10. Span of control refers to the number of individuals that one supervisor can manage effectively during a disaster. Maintaining an effective span of control is particularly important in incidents where safety and accountability are a top priority. Span of control is the key to effective and efficient incident management. Effective span of control may vary from 3 to 7. If the number of reporting elements fall outside of these ranges, expansion or consolidation of the organization may be necessary. The disaster triage nurse determines which patient should have the highest triage priority. It's immediate red. A 70-year-old female able to follow commands, respiratory rate of 36, palpable radial pulse, open skull fracture. A 25-year-old male covered in dust, respiratory rate of 16, walking at the scene of the disaster, fractures to both lower arms. A 19-year-old male with a GCS of 3, unable to maintain airway after 2 attempts at repositioning. A 30-year-old female, 14 weeks pregnant with a rigid abdomen, respiratory rate of 12, rapid pulse of 90, able to follow commands, pale. Age is not a factor in START triage system. START is simple triage and rapid treatment. The 70-year-old person with a GCS of 12 and a respiratory rate greater than 30 is triaged into immediate category. So here the first patient. Patient B is awake and ambulatory, tagged minor. Patient C has no respiratory efforts after airway positions, tagged deceased. And patient D is awake with good respiratory effort and pulse, tagged minor. Which of the following minimizes healthcare worker stress during and after a disaster? Assurance that he or she will be paid overtime, a debriefing at the start of the event, eliminating the ICS or the Incident Command System, having a personal disaster plan. Exposed healthcare workers are at an increased risk of acute stress during and following a disaster, terrorist attack, or other public health emergency. Having a personal disaster plan and knowing that their families and loved ones have a plan can help to minimize their stress. Overtime pay is good but meaningless during a disaster. The ICS is critical to an effective response. Debriefing is done after the event. So here they need having a personal disaster plan. The emergency department nurse is caring for a man who was thrown against a wall following an explosion and has a ruptured spleen. What is this injury considered? Primary blast injury, secondary blast injury, quaternary injuries, penetrating ballistic injury. The four basic mechanisms of blast or explosion injuries are termed as primary, secondary, tertiary, and quaternary. Blast wave or primary refers to the intense overpressurization impulse created by the explosion. Types of injuries include pulmonary barotraumas, abdominal hemorrhage and perforation, globe or eye rupture, and concussion. Secondary injuries are caused by projectiles carried by the blast pressure wave. They can be caused by penetrating ballistic missiles. Quaternary injuries are all other injuries caused by the explosion such as burns. So here this injury is a primary blast injury. Which of the following best explains the relationship between an MCI or a mass casualty incident and a disaster? All disasters are mass casualty events. All mass casualty events are disasters. Mass casualty events are natural disasters. Mass casualty events are man-made disaster. A disaster is an event that results in significant damage to life, property, or the environment. When a disaster causes injuries and death that overwhelm the local medical resources, then that event is called a mass casualty incident. Not all disasters result in human casualties, but all mass casualty incidents are caused by disasters. Which of the following contributes the most to positive patient outcomes in a mass casualty disaster? On-site patient treatment, disaster triage, transport of all victims to the closest hospital, availability of patient air transportation. During instances of multi-casualty incidents, triage is used to sort the casualties and is therefore one of the most important functions to be performed at the scene of an event. Triage is a continuous process used to ensure the most seriously injured persons can be quickly identified and taken to the right level of medical care. All victims should not be taken to the closest hospital, or that hospital will become overwhelmed and unable to function. Only life-saving measures are done on site. Air transport is good when necessary but not essential. So here disaster triage is the thing we need to follow. Several patients present to the triage nurse in an ED. They are complaining of skin redness, itching, vomiting and diarrhea. What does the nurse suspect the patients have been exposed to? Radiation, chemical agents, influenza, biotoxin agent. Acute radiation syndrome, also known as radiation poisoning, radiation sickness or radiation toxicity, results when humans are exposed to high levels of radiation. The resulting symptoms appear in an orderly fashion and can start within minutes to days after exposure. People who receive a high radiation dose can have skin damage that can start to show within a few hours. This includes swelling, redness and itching of the skin. Other symptoms include nausea, vomiting, headache and diarrhea. These patients usually do not have an elevated temperature. Chemical agent manifestations differ depending upon the agent but can involve respiratory or nervous system symptoms. The flu presents with respiratory symptoms, general malaise, and typically a fever. Biotoxin agent symptoms vary depending upon the agent. An ICS is set up at the scene of a disaster. Who has the responsibility for keeping ahead of the disaster by evaluating the status of the resources and determining future resource needs? Incident Commander, Planning Chief, Operations Chief, Logistics Chief. An incident command system is a standardized on-scene, all hazards incident management approach to disease management. The incident commander is responsible for leading all aspects of the response. The operations chief is responsible for all Tactical operations directly applicable to the response. The logistic chief is responsible for providing facilities, services, and materials necessary for the response, and the planning chief is responsible for preparing the incident action plan. This plan provides direction for action to be taken during specific operational periods of time. So here it is the planning chief. Which of the following contributes to a successful hospital disaster response? Aggressive resuscitation efforts for patients without a pulse, immediate response for patients as soon as they arrive at the emergency department, appropriate PPE to protect staff from contamination, decontamination area located within the ED. Personal protective equipments, a type of face mask, glove, or clothing that acts as barrier between infectious materials and the person. A successful disaster operation protects the greatest resource, that is the hospital staff. Disaster response and treatment does the most good for the most people. It does not advocate aggressive treatment for a patient without a pulse. To protect staff and other hospitalized patients, decontamination is done outside of the emergency department and before triage and treatment. Which of the following items is an essential component of your personal disaster plan? Water, fresh fruit, reading material, hazard flares. An emergency supply kit is a collection of items you might need during an emergency or disaster. Having 1 gallon of water per person per day is a critical supply. Fresh fruit and hazard flares are important but not as critical. Reading material is nice to have but obviously not critical. In the United States, the National Weather Service issued a tornado warning at 5:17 p.m. that included the city of Joplin, Missouri. It was in the year 2011. Two hospitals, St. John's Regional Medical Center and the Freeman Health System, provides medical care to the region and serve as the city's emergency medical service providers. Joplin City residents were given a 24-minute notice of the impending tornado. 25 tornado sirens sounded and weather alert boxes appeared in the corners of local TV stations. There were also 25 patients in the emergency department and approximately 100 staff members on duty. The announcement over the hospital speakers warned of a potential tornado and Plan Grey was activated. Plan Grey is the Tornado Emergency Operations Plan. No one panicked as such calls are routine in Joplin. Condition Grey is practiced several times a year. The storm came up quickly and passed over St. John's Hospital in 45 seconds. The hospital sustained a direct hit at approximately 5:41 p.m. Within seconds, the community of 50,000 were devastated and broken. Immediately following the tornado, emergency respondents were deployed to the city to undertake search and rescue efforts. The governor declared a state of emergency for the Joplin area shortly after the tornado hit and ordered Missouri National Guard troops into the city. In 45 seconds, the tornado destroyed St. John's Hospital. Everyone in the hospital thought they were going to die. IV lines were ripped from patients' arms and the IV poles became projectiles. All emergency lights and exit signs were ripped from their mounts and were useless, and the exit stairways were blocked by debris. X-ray machines, respirators, and computer monitors crashed through the air. Doors were ripped off their hinges. Fortunately, most people inside the hospital and the ED were uninjured. The response within St. John's Hospital went well. When the tornado warning was issued for Joplin, the hospital activated the Code Grey, its tornado response plan. Staff members simply did what they had to do. Patients were moved into safe area if possible and the staff braced for the impact. Very shortly after the tornado passed over the hospital, officials decided that the hospital was unsafe and they needed to quickly evacuate their 183 patients. Fortunately, the city's other hospital was closed and had suffered little damage from the tornado, so it was able to accept patients. 10 hospitals in Missouri also accepted patients from St. John's. Within 90 minutes, all the patients were evacuated and by 2 a.m., the situation at the hospital was largely under control. Tragically, in Joplin, despite a 24-minute advance tornado warning, 160 people died and more than 1,000 were injured. The tornado offers many important lessons about disaster preparedness. The National Weather Service final report had several observations and recommendations. First, tornado warning communication should be improved to convey a sense of urgency for extreme events. This will compel people to take immediate life-saving action. Since the first tornado forecast was made in 1948, tornado warning lead times have been increasing and now average 13 minutes. There is a 70% false tornado alarm rate. Because of this tornado warning fatigue, the vast majority of Joplin's residents either ignored or were slow to react to the first warning sirens and did not immediately take protective action. To help improve communication, partnership should be established with technology to develop GPS-based warning communications, including the use of text messaging, smartphone apps, and social media. For instance, the city of Joplin used both traditional mechanisms and social media, Facebook, Twitter, and YouTube to communicate emergency information to the public. Second, preparedness is key. Participation in the national level exercise helped to prepare federal, state, regional, local, and private sector personnel to respond effectively. Finally, volunteer effort is essential. It was key in the rapid evacuation of Mercy of St. John's Hospital. What aids communication of a potential tornado? Frequent tornado warnings, communication only when the tornado is visible, social media, text messaging, phone apps, loud sirens. Frequent warning, it causes warning fatigue. Warning only when tornado is visible will not provide enough time to seek safety. Loud sirens are effective, but there still be a warning fatigue. Recent recommendations include greater use of social media, text messaging, and phone apps. What is the average number of minutes of warning time forecasters can give before a tornado strikes? 90 minutes, 60 minutes, no advance warning is possible, 13 minutes. Despite modern technology, the average amount of time is only 13 minutes. What is the difference between a tornado watch and a tornado warning? A tornado watch means that a tornado has been spotted. A tornado warning means conditions are good for a tornado to come. A tornado watch defines an area where tornadoes are possible in the next several hours. A tornado warning means that a tornado has been spotted or that Doppler radar shows a thunderstorm circulation that can spawn a tornado. Tornado watch defines an area where tornadoes are possible in the next 48 hours. A tornado warning means a tornado has been spotted. A tornado watch and a tornado warning mean the same thing. They mean conditions are good for the tornado to come. A tornado watch is issued to alert people to the possibility of a tornado developing in that area. At this point, a tornado has not been seen, but the conditions are very favorable for tornadoes to occur at any moment. Whereas a tornado warning is a notification that a tornado has been seen or picked up by a radar. Which of the following actions at St. John's Hospital helped the most in the smooth response to the tornado? Preparedness due to frequent practice, quickly moving patients in darkened hallways, quickly moving patients in available transportation, volunteerism from the community. All the options help in time of disaster, but disaster preparedness due to frequent practice is the best action to facilitate a smooth response. Hope you understood this video. Keep watching for further videos. Thank you.